Welcome to session 3 on module 7, learning about grief, loss, and bereavement for the ALNEX series. In session 3, we're going to talk about preventing burnout, compassion fatigue, different things like that, and the nurse. So the nurse bears witness to so many different things that are heartbreaking: medical futility, prolonging suffering, denial of palliative services. This can lead to a lot of moral distress, seeing things occur that really shouldn't. These are things that occur above and beyond the normal suffering of patients, and they really take a toll on the nurse. So here is an example of something you might see. I'll let you read through that in your own time. So hazards of the helping profession. This, I mentioned secondary trauma, experiencing the trauma, symptoms of trauma without experiencing the original trauma. This occurs from prolonged exposure to the suffering of others. These are really intense emotions. They zap your energy. A lot of end-of-life issues, seeing physical and emotional suffering, seeing psychological pain, and that moral distress compounding as well. So the helping profession, like nurses, are very susceptible to intense emotions associated with this and secondary trauma. So it's very, very important to take care of yourself, to talk about what you're going through, to recognize it in yourself, and get the support that you need. Cumulative loss is talking about loss after loss after loss after loss. You know, the families, they experience the loss of a loved one. That's the loss that they experienced at that time. And often they're, not always, sometimes there's a lot of loss, but typically the loss is a little bit more spread out. But the nurse is seeing so much loss, and each loss builds and builds and builds. So again, just recognizing that this can happen and being aware of the susceptibility of the nurse to experiencing these cumulative losses. So recognizing compassion fatigue versus burnout. Compassion fatigue, it's really physical, emotional, and spiritual result of chronic and continuous self-sacrifice. It becomes difficult, or you're not able to love, nurture, care for, or empathize with others that are suffering. And burnout is that physical and psychological decrease in motivation. So a loss of motivation. A lot of things that trigger it are going to be like higher demands in the workplace, lack of resources to do your job and care for your patients, interpersonal stressors, things that are going on in your personal life, organizational policies, and it can often diminish caring, result in cynicism, and cause the nurse to feel less effective. So these are very real things that nurses encounter and experience sometimes on a daily basis. So some of the things that really can contribute to the stress in hospice and palliative nursing are things like workload. There's not a lot of hospice or palliative nurses. I mean, right now workload is outrageous anyways because there's just not the nurses. That sense of control, or that ability to control what's occurring. A lot of things are not within your control. Maybe there's some symptom relief management that you really want for your patient, but the insurance company will not approve it, and so that you can't get those resources for your patient. Bullying is really coming more to the forefront of the nursing profession. This, unfortunately, it occurs in nursing programs, it occurs in acute care, in clinics, in dialysis centers. It can occur anywhere. So it's repeated mistreatment of an individual. 27% of nurses say that they have past and or present experience with being the victims of bullying in the workplace, and 72% of the American public are aware of bullying in the workplace. I mean, it's a huge problem. It should not be tolerated, and in your actions, in your burnout, in your compassion fatigue, should you be experiencing this, think, are you being bullied or are you doing the bullying? Often with burnout and compassion fatigue, suddenly we just don't care. We're very cynical. We can't find ourselves available to help out others. We've become very rude and short with others, and then we ourselves turn into the bullies. So ask yourself, is this happening to you? How are your actions impacting others? What are your intentions with the words you use? And don't be a part of the bullying. Don't allow bullying to occur. All this is self-awareness is necessary for all these things. So how you can become more self-aware: self-reflection, body monitoring, having a wellness plan. So noticing things about yourself. Those of you who had 301 with me and did the wellness journal, though that wellness journal was an exercise of body monitoring. Oh, my jaw is really tight. Why is my jaw tight? Oh, I'm really pissed off about something, or I'm really nauseated. What's going on? I'm anxious about a test that's coming up. Different things like that. My muscles are sore. My neck is killing me. Notice those responses in your body that are occurring, because those are that's your body trying to tell you that you are stressed and that you really need to do something about it. And then having that wellness plan, knowing what you need to do to take care of yourself, is also critically important, because you need to have a plan in place to address your own wellness to prevent things like burnout and compassion fatigue. The nurse really, so much of the nursing profession is emotional labor. It requires energy, it requires resources from yourself. Without taking time to rest, things like stress, emotional exhaustion, cynicism, inefficiency, all these things increase. So it's important to have that balance in your life. It really promotes that optimism, that resiliency. Taking care of yourself helps you to be a better nurse. It helps your overall wellness. It's so important. I cannot stress it enough. In the past, healthcare professionals were frequently told to control their emotions and to be emotionally distant, both from themselves, the patients, their families, and patients at the end of life require intense interpersonal involvement and compassionate care. So you really cannot distance yourself and be a good nurse at the same time. That's not to say that you can't protect yourself and build walls. It's this very, very difficult balancing act. And as you go through your nursing career, it's like a pendulum. You're going to swing too far towards cynicism, then you will swing too far towards being broken by the suffering that you see, and then you'll start to swing the other way. So it's all about finding that balance. Personal history with death affects the professional level and possibly impacts unresolved grief issues and the nurse's ability to cope with caring for dying patients and their families. So practice environments will impact reactions to death. For example, staff who work in a long-term care facility may not be optimistic about growing old, as they see the minimal respect and value that older adults have in the care that they receive. I will say this is absolutely true for me, because I was a CNA for 3 years as I put myself through the nursing program, through my prereqs and then my nursing degree, and seeing that, I don't want to get old. I just don't want to get old. Because of what I've seen. So support systems are very, very important as well. The presence or absence of a support system can really, really influence the ability to move through stages of adaptation or adapting to the emotional labor that is constantly bombarding the nurse. Emotional support by peers, families, co-workers that's all very, very important. Nursing faculty, it really increases the capacity to adapt and cope with caring for those that are dying. So taking care of yourself, every person has their own unique way to take care of themselves. It's all about balancing work and play. So things like traveling, reading, journaling, meditating, different things like that. Some people will find that very helpful, others will not. Journaling for me, I find it very unhelpful. It doesn't do anything but stress me out. So I know that journaling is not a way that I can take care of myself. Whereas going for a run or going rock climbing or paddleboarding, backpacking, just getting into the middle of nowhere where there's no one around me, that is what helps me to recharge and helps me to take care of myself. So learn who you are and what you need, and incorporate what you need into your holistic plan of how to care for yourself. Nursing care, it does not end with the death of the patient. It continues to caring for families in their grief. And nurses really need to recognize and respond to their own grief and that cumulative loss that they experience on a day-to-day basis. Bereavement care is interdisciplinary, and nurses must role model excellent care. I mean, nurses are the forefront in so many aspects of patient care along the illness continuum. It's truly an honor to be a nurse, really, and exciting to be that example of what good care looks like. So this is wrapping up our discussion on loss and grief. We'll talk about it more in class. We'll look at specific examples, and we'll also talk about how to take care of you, the nurse, as you experience these repeated griefs, as you undergo this emotional labor. So think about who you are, what you need. If you did that care plan, a self-care care plan in 301, get that back out, look at it. It may need revised, but start thinking again about that plan on how to take care of you as you care for those that are dying.